Olympic Community of Health is a nonprofit in the Olympic region, which includes Clallam, Jefferson, and Kitsap counties and 7 tribal nations. We prioritize collaboration across the region, tackling health issues no single sector or tribe can tackle alone. This video series brings bite-sized conversations addressing local health challenges directly to your screen. We invite you to grab a cup of coffee or tea and join us as we dive into today's topic. Many communities are faced with complex health challenges. The common approach to address these challenges is different groups, organizations, and tribes working in their own individual directions. This practice of separate solutions leads to silos and gaps between community-based organizations and clinical providers. These gaps negatively impact the health and well-being of community members. Imagine a collaborative approach that brings different partner types together to maximize impact. Much of what influences health happens outside the walls of healthcare. By combining strengths and resources, together we can meet people where they are at and foster a healthier community. Olympic Community of Health has seen the incredible impact of many creative partnerships across the region. A collaborative approach often reduces barriers to accessing care, helps connect people to the resources they want and need, and creates pathways to healthy and thriving lifestyles. 2 partners who have set a strong example of bridging traditionally siloed fields of work are the Port Angeles Fire Department and Peninsula Community Health Services.
My name is Danielle Gorman. I work with Peninsula Community Health Services. I'm the outreach coordinator, and I am drinking a pumpkin spice latte.
My name is Gerdes. I work for Port Angeles Fire Department. I'm a community paramedic, and I'm drinking an Americano with a little bit of milk. Can you describe the need for community clinical partnerships?
Well, I believe there's a need for the partnerships because depending on the needs that the clients have, we're able to create that partnership to meet them where they're at with their needs and break down all the barriers that they're having, whether it be transportation or food, or maybe they just have some basic medical needs that they're just afraid to talk about. So if we have those partnerships, we can reach out to, A, B, or C, and get them all of the things they need so that they can be in a healthier space.
We're kind of in the same situation working with our patients, and I think with the fire department, we've found a gap that we fit into. For us, the importance is not as much for the patient, but it's being kind of a gap closer between all of the other organizations. We have the behavioral health element, the primary care physician, and then we help do whatever. We'll go out there with a tablet so that they can talk to their doctor from home. So we'll go out there, gather a set of vitals, do an EKG or whatever the doctor wants. Maybe they want us to go draw blood prior to the appointment, so we can go spend 45 minutes doing a deep patient evaluation to try and figure out what's wrong and why are they calling 911, why are they going to the emergency department all the time. And so most of our partner relationships are along those lines. We want to reduce the amount of 911 calls, we want to reduce the amount of ED admissions and readmissions, and just kind of bring care into the home. It sounds like you kind of do the same.
Yeah, so we started a program called Bremerton Ambulatory Team, and we were working very closely with the Bremerton Fire Department. And a lot of the frequent users or frequent callers of 911, the fire department or fire chief would get in contact with one of our PAs, and he can reach out with like a bus. We would drive out to their house with either a medical assistant or a community health worker and kind of just meet them and find out what their needs are, because this isn't 911 worthy where you need to go to the hospital and they're calling every night.
But you guys do like dental and...
We have dental and medical, and behavioral health as well.
Cool. So how does your partnership work with Salvation Army?
So we have a program called Stand By Me. And it's where we base a community health worker. We have a pair of community health workers actually who are stationed inside an office at the Salvation Army. So we kind of work with them to build that trust and that relationship with them to find out what it is they need to get to a more of a stable environment instead of relying on the shelter. So whether
That's a really good idea.
Yeah, whether that be care coordination directly with them and their medical needs to get appointments with the clinic, because they have access to our system. It's our employee. Trish is our Salvation Army's CHW, and she has gotten several of the clients from Salvation Army into housing since she's been there.
Is this just the community health worker that's doing this? Mm-hmm. Okay, so they're involved in reaching out to housing and helping them fill out applications and all that.
Yeah,
Okay.
so care coordination and like all angles, whatever that person is saying. Yeah.
That's a lot of work. So how has what you guys do, your agency, impacted the people in your community?
Probably one story in particular that sticks with me. When we started on our mobile unit, there was a young man who was heavily into substance use and reached out to us after a while of being there and said, "Hey, I need some help and I have no idea where to start." He continued to follow all the steps that were required, and he started to divulge that he was struggling with multiple different addictions, and aside from just opioids, he was also struggling with methamphetamines and wanted a little more additional help because he wanted to get his custody of his son back. He agreed to do counseling, the substance use disorder counseling on top of the behavioral health counseling, as well as the medical assisted treatment program, which is a lot when you're homeless and going through all of that. But again, we were right there. We came to him. He didn't have to go find us. A couple years later, he got a job. He got his kid back. He had built his relationship back with his parents. And he had thanked us for being there for him and that he didn't know where he'd be today without us. Kind
of a cool partnership we have is with our BHASO, Peninsula Behavioral Health out on the peninsula. And they have a lot of patients that we kind of work more with the homebound patients side of thing and the homeless population. And so for them, the doctors will get a hold of us and say, "Hey, can you go provide antipsychotic injections to these patients?" And they'll just give us a name and we'll go find them and give them their injections once a month. And that way we have we're able to monitor that. We have another partnership with Rediscovery, which is their substance use professionals and their peers. So they're out on the streets all the time working with homeless population and people with substance use disorder. And we have an interesting partnership with them and the Sheriff's Department where we also give Vivitrol injections as people come out of the jail so that they can get out on the streets and have a better chance at success. We work very closely with North Olympic Healthcare Network. They provide some grant money so that we can operate our program. And they, with their patients, we work with the clinical health workers. And we get together every week in a kind of a larger setting where we have multiple agencies involved working with the most difficult patients. What's your favorite thing? What do you like best about what you're doing?
I think my favorite part about this is being able to be a part of the community, being able to give back. I have personal experience. I was in a domestic violence relationship. I was homeless, living in my car for about a year when I moved to Washington. And I lived in my car with my baby son. And I had no idea there were resources like food banks. Like, there's food in a bank. Like, what is a food bank? So being able to be that person that can help connect the spokes to make the wheel go around, I feel like it's very rewarding to make a difference in that person's life, to watch, a person dust off and shine. I like being able to be that person that can, even if it's for a few minutes, help them feel good.
Having this network of little agencies and little stopgaps, we kind of create a, this is sound really cheesy, but like a web or something where we can, we don't offer it. We can't help you with that, but these guys can.
Everyone has a role to play in this important work, and by working together, creating new and creative partnerships across different organizations and tribes, we can maximize our collective impact. OCH is inspired by so many different innovative partnerships and people like Danielle and Brian, thinking creatively about how to work alongside their neighbors to better meet community health needs. North Olympic Healthcare Network collaborated with WSU Extension, First Step Family Support Center, and Molina Healthcare to produce a series of cooking shows featuring providers using the recipes from Good and Cheap Cookbook. Kitsap Children's Clinic contracted with Catholic Community Services to connect patients to timely and convenient behavioral health care. These are just a few ways that community-based organizations and clinical partners can come together and combine strengths in a way that creates incredible health improvements. We know it can be a challenge to initiate new partnerships, especially with limited time and resources to work with. Local providers share that the most common elements of a successful partnership are communication, trust, and a shared vision. Many community and clinical partnerships have not only seen improved workflows, community outcomes, and maximized resources, but have even seen cost savings, which means more sustainable care for the community. We are stronger together, and through collaborative action, we can foster a region of healthy people, thriving communities. Learn more about how you can join this important work by going to olympic.ch.org.